Well, to weigh in more on the vaccine, joining me via phone right now is Datuk Dr. Alice Prethima Michael, a wellness physician. Hi, Datuk Dr. Alice. It's good to speak to you again after a long hiatus, perhaps. Do you think the current batch of COVID-19 vaccines will provide long-term protection, Doctor, in your opinion?
Hi, Jessie. Thanks for having me in the show. I'm very happy to be speaking about this issue because I do want the rate of people who want to be vaccinated to go up, by leaps and bounds. I want it to go up. But let's talk about, let me answer your question, okay? So long-term, because this SARS-CoV-2 vaccination has been produced and it was first tested only, maybe about 280 days, less than 280 days after the COVID was, the novel coronavirus was termed as a pandemic, okay? So it was a very fast development of the virus. That does not mean any corners have been cut. It's been done, phase 1 and phase 2 trials have been done. But it's far too soon to say for sure how long this immunity is going to last. So at this moment, what we know is we do need a second dose of booster dose of the vaccine after about 3 weeks to 1 month. And now currently there is a trial going on also looking at a third dose that may be used, especially in variants. Because of the length, the short period, we know that at this moment from December to now, we know maybe 3 to 4 months definitely the vaccine is very effective. But let's keep our fingers crossed that this vaccine will at least last for a year. And of course, if it lasts 3 or 4 years, that's going to be a bonus, yeah?
Well, you did say, it's far too soon and a booster shot may be needed. So in all this sort of, issue as well, there has been a lot of speculation. People are still doubtful as to the effectiveness of the vaccine, Doctor. Perhaps you could help put this in perspective. How do we know the COVID-19 vaccines are safe? How do I know I will be safe?
It is not a vaccine that has not been tested, okay? It has been tested. But it has been done in a fast-track way. But fast-track way does not mean it's been done carelessly. Okay, so we do know that life-threatening complications is not present, except for a very, few group of people in the population. So basically, I think that we have to be encouraged by the positivity that it is reducing morbidity and mortality. That means it is reducing deaths. And it is definitely reducing the amount of complications that one has to live with if you were infected with the COVID-19 virus. So the vaccination does give you yourself the protection. Then, of course, it also helps to limit the spread of the virus in the population. And other than that, of course, you also, if a lot of people were to be vaccinated, that small group of people that's contraindicated, who are the special group that may be, pregnant, women. It can be very young children. It may be people who are compromised immunologically. That means their immune function is not very good, or they are on certain medications for certain medical conditions that will keep their immune function down. These are special groups who could not be vaccinated without having a big risk. Okay. So when a lot of people, say 80 to 95% of the population, if they were to be vaccinated, then that also provides herd immunity. So it gives protection to these people that could not be vaccinated due to their special medical conditions.
Right, Doctor, not much time left on the clock, but I did want to ask you this. Of course, you've been a physician for years with extensive amount of experience and knowledge as well. What would you say at this point to our viewers about the benefits of being vaccinated?
I think like what I said just now, the safety definitely will outsmart the risk. The safety is more than whatever small risk you're looking at. And so far, all the phase 3 trials have definitely shown that there is no life-threatening complications. Okay, complications you may get will be like some swelling, redness at the injection site. You may get a bit of flu-like symptoms. You may get some fatigue, and you may feel a little bit nauseous, or, these are rarer. But basically, redness and swelling and feeling fatigue are the general complications. And none of this we don't call it complications, we call it side effects, or it actually means that the vaccine is working. It is not a bad side effect. Your body is picking up the immune function to ward itself against the evil COVID-19. So why should we be afraid to immunize ourselves? Why should we be afraid to vaccinate ourselves? We should get ourselves vaccinated. So the risk is there because the cases are going down, but the cases are still there. So the faster we get ourselves protected against all the complications of COVID, which is not just fever and flu, it can be respiratory problems that can go on throughout your life. So even
That's right. I think, Doctor, you said it right. The faster we are vaccinated, the faster hopefully we will get rid.
Yeah, and I think younger people need to be vaccinated, because if not, they can be spreading it to elders and, the medically compromised people as well.
That's right. Thank you very much, Doctor, for weighing in. Dr. Alice Prethima Michael joining us, wellness physician, to weigh in on, of course, the vaccine, benefits of the vaccine, and some of perhaps, hopefully that would have helped to sort some of the doubts that many people are still in two minds about, to be vaccinated or not to be vaccinated. We take a short breather at this point. When we come back, I'll be speaking.